So what brings you in today?
I had an appointment.
Yes. I know. Why did you make the appointment?
Because I wanted to see a doctor.
Please kill me. Why did you want to see a doctor?
I have an unusual discharge from my penis.
Lovely. Can you describe this unusual discharge?
It is unusual.
Can you be any more specific?
It is yellowish and thick.
Wonderful. How long has this been going on?
I don't know.
A day? A week? Your entire life?
Somewhere in between the last two.
Okay. It would be helpful if you could be a little more specific.
It has been going on for a while.
I am not sure you know the meaning of the word specific. Is there a reason you decided to come see a doctor about this today?
Yes. I had an appointment.
Oh dear. Is there a reason you made the appointment now, and not when the problem first started?
Yes.
Was the reason to punish me?
No.
Did one of my colleagues tell you to make an appointment with me?
No.
Is someone paying you to torture me?
No.
Then what is the reason you made the appointment today?
I was tired of having a discharge from my penis.
Of course. Have you ever had an STD before?
What is an STD?
It is a sexually transmitted disease.
Oh. I don't think so.
Okay.
Wait. Does genital herpes count?
Yes.
Oh. Then I have had an STD before.
Terrific. Before the unusual discharge started, had you had unprotected sex?
I don't know.
You don't know if you had sex, or you don't know if it was unprotected?
Both.
Good God. Did you have sex?
Probably.
Did you use a condom?
Probably not.
Is there a reason you don't remember for sure?
I don't know.
Is it possible you were also using drugs?
That is possible.
That is not a surprise. Do you happen to know what drugs you were possibly using?
I am not sure that I do.
Are you still using drugs?
It is possible.
Terrific. We are going to run some tests. I am going to need a sample of your urine.
Will you be testing this urine for drugs?
Yes.
Then I would rather not give you a sample of my urine.
Unfortunately for our local community, I am not allowed to report the results of your test to the police. I am only trying to provide the best medical treatment I can. In order to do that, I need to take a sample of your urine. I will also need to do a swab test of your penis.
Will that involve inserting something into my penis?
Yes.
I would rather you did not do that.
Trust me. I would also rather not do that. But it will help me diagnose your problem so that we can treat it.
Can you give me a sedative before you insert something into my penis?
No.
Can you give me a sedative anyway?
No.
My friend said that, if I ask a doctor for a sedative, it is possible that he would give me a sedative.
Is your friend addicted to drugs?
Yes.
Great. The swab test will only take a few seconds. You will not need a sedative.
I was hoping to get a sedative.
I can imagine that you were.
I thought the sedative might help with the swelling I have been experiencing in my lymph nodes.
Oh no. You do realize you could have mentioned earlier this swelling in your lymph nodes.
You did not ask about swelling in my lymph nodes. So can I have a sedative?
Please stop asking me for a sedative. A sedative will not help any swelling in your lymph nodes. Now that I have told you that, do you still have swelling in your lymph nodes?
Yes.
That is unfortunate. How long have you had swelling in your lymph nodes?
I don't know.
Of course you don't. Do you have any other symptoms that I have not asked about?
No.
Okay.
Wait. Do night sweats count as a symptom?
Yes.
How about a recent loss of weight?
Yes.
Fatigue?
Yes.
Muscle aches?
Yes. Those are all symptoms. Have you ever been tested for HIV?
Yes. I have been tested for HIV.
And what were the results of that test?
I do not know. Someone tried to call me about the results, but I did not call them back. Then I forgot all about it.
That is great.
I did not remember anything about it until just now.
That is wonderful. And you have had unprotected sex since then?
Very probably.
With any new partners?
Almost certainly.
You are going to need to contact those partners and have them come in for testing. Hopefully there will be a different doctor in the clinic on that day.
I do not think I want to do that.
Why not?
It seems like it would impede my ability to have unprotected sex in the future.
Wow. That does seem like it is probably true. Are there any more medical issues you have not told me about?
No.
Okay.
Wait. I also have a lump in one of my testicles.